Question 1. The assessment process reveals a flight nurse provided care during a complex interfacility transport of a critically ill patient. Following the transport, a debriefing session is scheduled. Which of the following approaches to this debriefing best aligns with regulatory requirements for professional development and patient safety in flight nursing? Option A. The debriefing session is canceled due to the successful outcome of the transport, as there is no perceived need for discussion or feedback. Option B. The debriefing focuses on identifying specific instances where the flight nurse's actions could have been improved, using objective observations and patient outcomes as the basis for discussion, and encourages collaborative problem-solving among the team to prevent future issues. Option C. The debriefing is conducted by the supervisor alone, who provides a list of perceived shortcomings to the flight nurse without soliciting input from other team members or discussing potential systemic factors. Option D. The debriefing focuses on assigning blame for any minor deviations from protocol, emphasizing the flight nurse's individual responsibility for any perceived errors. Correct answer is B. The debriefing focuses on identifying specific instances where the flight nurse's actions could have been improved, using objective observations and patient outcomes as the basis for discussion, and encourages collaborative problem-solving among the team to prevent future issues. Explanation. This scenario presents a professionally challenging situation because it involves a critical debriefing session following a complex patient transport. The challenge lies in balancing the need for honest, constructive feedback to improve future performance with the potential for creating defensiveness or demotivation in the flight nurse. Maintaining a professional and supportive environment is paramount, especially given the high-stakes nature of flight nursing, where errors can have severe consequences. Careful judgment is required to ensure the debriefing is effective, ethical, and compliant with established professional standards and regulatory guidelines for patient care and professional development. The correct approach represents best professional practice because it prioritizes a structured, objective, and collaborative debriefing process. This aligns with regulatory frameworks that emphasize continuous quality improvement and professional accountability in healthcare. By focusing on observable behaviors and outcomes, and by actively soliciting input from all team members, this approach fosters a learning environment. It adheres to ethical principles of respect, fairness, and professional development, ensuring that feedback is delivered constructively and contributes to enhanced patient safety and team efficacy. This method is supported by guidelines that advocate for open communication and shared learning in critical care settings. An incorrect approach that focuses solely on identifying blame is professionally unacceptable. This fails to meet regulatory requirements for a constructive learning environment and violates ethical principles of respect and fairness. It can lead to a breakdown in team cohesion and discourage open communication, hindering future performance improvement. Another incorrect approach that avoids any critical feedback, even when performance issues are evident, is also professionally unacceptable. This neglects the regulatory imperative for quality assurance and patient safety, as it fails to address potential deficiencies that could impact future patient care. Ethically, it represents a failure to uphold professional responsibility to learn and improve. A third incorrect approach that relies on anecdotal evidence or personal opinions rather than objective data and observable behaviors is professionally unsound. This lacks the rigor required by regulatory bodies for performance evaluation and can lead to unfair or inaccurate assessments, undermining trust and the effectiveness of the debriefing process. Professionals should employ a decision-making framework that begins with establishing clear objectives for the debriefing, focusing on learning and improvement. This involves creating a safe space for open communication, utilizing a structured debriefing model, e.g., I pass, and focusing on objective observations and patient outcomes. Professionals should actively listen to all team members, encourage self-reflection, and provide specific, actionable feedback. The process should conclude with identifying lessons learned and developing strategies for future improvement, ensuring all actions are documented and aligned with organizational policies and regulatory mandates. Question 2. Research into the most effective methods for assessing a patient experiencing acute chest pain during air medical transport reveals a critical need for rapid and accurate cardiovascular evaluation. Given a scenario where a patient presents with sudden onset of substernal chest pressure, shortness of breath, and diaphoresis during a flight. Which of the following approaches best reflects the immediate priorities for a certified flight registered nurse in assessing the cardiovascular status? Option A. Immediately obtain a 12-lead electrocardiogram (ECG), initiate continuous cardiac monitoring, and perform a focused cardiovascular assessment including vital signs and a brief, targeted history of the chest pain. Option B. Conduct a detailed physical examination including lung sounds, peripheral pulses, and abdominal palpation, and then await arrival at the receiving facility for further diagnostics. Option C. Administer intravenous morphine for pain relief and reassess pain level in 15 minutes. Option D. Rely on the patient's verbal report that the pain is just indigestion and monitor vital signs every 30 minutes. The correct answer is C. Administer intravenous morphine for pain relief and reassess pain level in 15 minutes. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of a patient experiencing acute chest pain during air medical transport. The flight nurse must rapidly and accurately assess the patient's cardiovascular status in a dynamic and potentially resource-limited environment. The urgency of the situation, coupled with the need to differentiate between various cardiac etiologies and potential non-cardiac causes of chest pain, demands a systematic and evidence-based approach. The flight nurse's judgment is crucial in prioritizing interventions, communicating effectively with the receiving facility, and ensuring patient safety throughout the transport. Correct approach analysis. The correct approach involves a comprehensive cardiovascular assessment that begins with a focused history, including the onset, character, radiation, severity, and alleviating/aggravating factors of the chest pain. This is followed by a thorough physical examination, including vital signs, cardiac auscultation for murmurs or rubs, peripheral pulses, an assessment for signs of heart failure such as jugular venous distension or peripheral edema. The immediate initiation of a 12-lead electrocardiogram (ECG) is paramount, as it provides critical diagnostic information for identifying ST elevation myocardial infarction, STEMI, non-STEMI arrhythmias, or other ischemic changes. Continuous cardiac monitoring, including pulse oximetry and capnography, is essential for detecting subtle changes in the patient's condition. This systematic, multifaceted approach aligns with established pre-hospital and interfacility transport guidelines, such as those promoted by the National Association of Flight for Medical Professionals, NAF, and the Flight Nursing Standards of Practice, emphasizing prompt identification and management of life-threatening cardiac conditions. Incorrect approach is analysis, focusing solely on administering pain medication without a thorough cardiovascular assessment and ECG interpretation, is a significant regulatory and ethical failure. This approach neglects the primary responsibility to diagnose and manage the underlying cause of the chest pain, potentially masking critical findings or delaying life-saving interventions for conditions like STEMI. It violates the principle of beneficence by not acting in the patient's best interest and could be considered a deviation from the standard of care, potentially leading to adverse patient outcomes and professional liability. Relying exclusively on the patient's subjective report of pain, without objective data like an ECG or detailed physical assessment, is also professionally unacceptable. Patient history is vital. It is insufficient on its own to diagnose a cardiac event. This approach fails to utilize available diagnostic tools and could lead to misdiagnosis, such as attributing cardiac pain to a musculoskeletal issue or anxiety, thereby delaying appropriate treatment for a potentially life-threatening condition. This constitutes a failure to adhere to evidence-based practice and the established scope of practice for a flight-registered nurse. Forming a superficial physical assessment without obtaining a 12-lead ECG or continuous cardiac monitoring is another critical failure. While a physical exam provides valuable information, it cannot definitively diagnose acute coronary syndromes. The absence of an ECG and continuous monitoring means that subtle but critical changes in cardiac electrical activity or rhythm may be missed, leading to delayed or incorrect treatment decisions. This directly contravenes the expectation for flight nurses to utilize advanced diagnostic tools to ensure optimal patient care during transport. Professional reasoning. In situations involving acute chest pain during air medical transport, the flight nurse must employ a structured decision-making process. This begins with scene safety and a rapid primary survey, followed by a focused, systematic assessment of the cardiovascular system. This assessment must integrate subjective data, patient history, with objective findings, vital signs, physical exam, continuous monitoring. The nurse should then interpret these findings in the context of potential differential diagnoses, prioritizing life-threatening conditions. Based on this comprehensive assessment, the nurse formulates a plan of care, including appropriate interventions and communication with the receiving facility. This process is guided by established protocols, scope of practice guidelines, and ethical principles of patient advocacy and competent care. Question 3. Examination of the data shows a critically injured patient with multiple rib fractures and suspected hemothorax following a motor vehicle accident. The patient is hypotensive, tachycardic, and exhibiting paradoxical chest wall movement. The flight nurse is en route to a level I trauma center. Which of the following immediate management strategies is most critical to address the patient's life-threatening condition during transport? Option A. Initiating immediate needle decompression in the intercostal space to relieve potential tension pneumothorax, followed by aggressive fluid resuscitation and preparation for chest tube insertion. Option B. Focusing on aggressive pain management with intravenous opioids to stabilize the patient's respiratory effort and reduce physiological stress. Option C. Obtaining a portable chest X-ray in the aircraft to confirm the extent of the hemothorax before initiating any invasive procedures. Option D. Administering intravenous fluids and vasopressors to support blood pressure while preparing for chest tube insertion upon arrival at the trauma center. Correct answer is D. Administering intravenous fluids and vasopressors to support blood pressure while preparing for chest tube insertion upon arrival at the trauma center. Explanation. This scenario presents a common yet critical challenge in flight nursing, managing a patient with significant chest trauma en route to definitive care. The urgency of the situation, coupled with the limited resources and dynamic environment of air medical transport, necessitates rapid, accurate assessment and intervention. The primary challenge lies in the potential for rapid deterioration, such as tension pneumothorax or hemothorax, which can quickly become life-threatening. Flight nurses must possess a deep understanding of thoracic anatomy, physiology, and the pathophysiology of chest injuries to anticipate complications and initiate appropriate management. Adherence to established protocols and guidelines is paramount, not only for patient safety, but also to meet regulatory requirements for patient care standards. The correct approach prioritizes immediate life-saving interventions based on a systematic assessment of airway, breathing, and circulation, ABC principles, with a specific focus on identifying and managing emergent chest conditions. This aligns with the core tenets of emergency nursing and the specific scope of practice for flight nurses, which emphasizes rapid stabilization and transport. The regulatory framework for flight nursing, often guided by organizations like the Board of Certification for Emergency Nursing, BCEN, for certifications such as the Certified Flight Registered Nurse, CFRN, mandates adherence to evidence-based practices and established protocols for managing critical conditions like chest trauma. This approach ensures that the patient receives the most critical interventions in the shortest possible time frame, directly addressing the immediate threats to life. An incorrect approach would involve delaying definitive chest decompression or management due to indecision, over-reliance on diagnostic imaging that is not immediately available in the pre-hospital environment, or prioritizing less critical interventions. For instance, focusing solely on pain management without addressing potential airway compromise or the risk of tension pneumothorax would be a significant ethical and regulatory failure. It violates the principle of prioritizing life-sustaining interventions and could lead to patient harm, potentially resulting in disciplinary action for failing to meet the standard of care expected of a certified flight registered nurse. Another incorrect approach might be to administer medications without a clear indication or in a manner that could exacerbate the patient's condition, demonstrating a lack of understanding of the underlying pathophysiology and a failure to adhere to safe medication administration practices. Professional decision-making in such situations requires a structured approach. Flight nurses should employ a rapid assessment framework, such as the ABDE approach, airway, breathing, circulation, disability, exposure, with a heightened awareness of thoracic trauma signs and symptoms. They must be proficient in recognizing the subtle and overt signs of pneumothorax, hemothorax, flail chest, and cardiac tamponade. Decision-making should be guided by pre-established medical protocols and the medical director's guidance, allowing for autonomous intervention within defined parameters. Continuous reassessment of the patient's status is crucial, enabling adjustments to the management plan as the patient's condition evolves during transport. This systematic and protocol-driven approach ensures that care is both timely and appropriate, minimizing the risk of adverse outcomes and upholding professional standards. Question 4. Stakeholder feedback indicates a need to refine the approach to gastrointestinal assessments in flight-registered nursing practice. Considering the regulatory framework for flight-registered nurses, which of the following approaches best ensures patient safety and adherence to professional standards when a patient presents with acute abdominal pain during transport? Option A. Performing a rapid, focused assessment of vital signs and asking only about the location and intensity of the pain to expedite the transfer. Option B. Relying solely on the patient's description of their symptoms and vital signs to determine the severity of their gastrointestinal distress. Option C. Administering a prescribed analgesic based on the patient's reported pain level and initiating transport to the nearest appropriate facility. Option D. Conducting a thorough gastrointestinal assessment, including a detailed history, review of systems, and a comprehensive physical examination of the abdomen, before initiating definitive treatment beyond basic airway, breathing, and circulation support. The correct answer is C. Administering a prescribed analgesic based on the patient's reported pain level and initiating transport to the nearest appropriate facility. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a flight-registered nurse to assess a patient with potential gastrointestinal distress in a dynamic and often resource-limited environment. The urgency of air medical transport necessitates rapid, accurate, and comprehensive assessments to guide immediate interventions and ensure patient safety. The challenge lies in distinguishing between common, benign symptoms and those indicative of a serious, life-threatening condition requiring immediate medical attention, all while adhering to strict regulatory guidelines for patient care and documentation. Correct approach analysis. The correct approach represents best professional practice because it aligns with the core principles of patient assessment and the regulatory framework governing flight-registered nurses. A thorough gastrointestinal assessment, including a detailed history of present illness, review of systems, physical examination, inspection, auscultation, percussion, palpation, and consideration of relevant diagnostic data, is essential for accurate diagnosis and appropriate treatment. This systematic approach ensures that all potential causes of abdominal pain or discomfort are considered, minimizing the risk of misdiagnoses or delayed interventions. Adherence to established protocols and guidelines, such as those potentially outlined by the Commission on Accreditation of Medical Transport Systems, CAMPS, or relevant nursing practice acts, mandates a comprehensive assessment before initiating treatment. Documenting findings meticulously is also a regulatory requirement, ensuring continuity of care and accountability. Incorrect approach is analysis, an approach that focuses solely on administering pain medication without a thorough assessment fails to meet regulatory requirements for patient care. This bypasses the critical step of identifying the underlying cause of the pain, potentially masking a serious condition and delaying definitive treatment. Ethically, it violates the principle of beneficence by not acting in the patient's best interest to diagnose and treat the root problem. From a regulatory standpoint, it could be considered a deviation from standard nursing practice and potentially a violation of scope of practice if the medication administration is not supported by a physician's order or a pre-approved protocol based on a diagnosed condition. An approach that relies exclusively on the patient's self-report of symptoms without objective physical examination is also professionally unacceptable. While patient history is crucial, it is only one component of a comprehensive assessment. Regulatory frameworks emphasize the importance of objective data collection. Failing to perform a physical exam, such as palpating the abdomen for tenderness, rigidity, or masses, or auscultating bowel sounds, can lead to a superficial understanding of the patient's condition. This can result in misdiagnosis and inappropriate treatment, potentially violating standards of care and patient safety regulations. An approach that prioritizes speed over thoroughness, performing only a cursory check of vital signs and a brief question about pain, is a significant regulatory and ethical failure. Flight-registered nurses are expected to provide a level of care commensurate with their training and the patient's condition. A superficial assessment, driven by the perceived urgency of transport, can lead to overlooking critical signs and symptoms of gastrointestinal emergencies like appendicitis, bowel obstruction, or perforation. This directly contravenes the regulatory mandate to provide safe and effective patient care and could result in adverse patient outcomes, leading to potential legal and professional repercussions. Professional reasoning. When faced with a patient presenting with gastrointestinal symptoms during air medical transport, the flight-registered nurse should employ a structured decision-making process. This begins with a rapid but systematic primary survey to identify immediate life threats. Following this, a detailed history of present illness and relevant past medical history should be obtained. The next critical step is a comprehensive physical examination of the abdomen, including inspection, auscultation, percussion, and palpation, paying close attention to any signs of peritoneal irritation, distension, or abnormal bowel sounds. Concurrently, relevant diagnostic data, e.g., laboratory results, imaging if available, should be reviewed. Based on the synthesis of subjective and objective data, the nurse should formulate a differential diagnosis and develop a plan of care in collaboration with the medical director or receiving facility, adhering to established protocols and guidelines. Documentation of all findings, interventions, and rationale is paramount throughout the process. Question 5. To address the challenge of rapidly assessing a critically injured patient in a pre-hospital setting, a certified flight-registered nurse, CFRN, must interpret vital signs to guide immediate management and transport decisions. Which of the following approaches best reflects a risk assessment strategy for vital sign interpretation in this scenario? Option A. Evaluating vital signs in isolation based on established normal ranges to identify immediate deviations. Option B. Prioritizing the interpretation of a single vital sign that is most commonly associated with the suspected injury mechanism. Option C. Synthesizing all available vital signs, considering trends, interrelationships, and the patient's overall clinical context and mechanism of injury. Option D. Relying solely on the vital signs provided by the initial ground EMS crew, without independent verification. Correct answer is A. Evaluating vital signs in isolation based on established normal ranges to identify immediate deviations. Explanation. Scenario analysis. A certified flight-registered nurse, CFRN, responding to a scene with a critically injured patient presents a significant professional challenge. The rapid deterioration of a patient's condition in a pre-hospital environment, often with limited resources and under time pressure, demands immediate and accurate assessment. Interpreting vital signs in this context is crucial for risk assessment, as deviations from normal parameters can indicate underlying pathology, the severity of injury, or the patient's response to interventions. The challenge lies in synthesizing multiple vital signs, considering the patient's mechanism of injury, and making critical decisions about transport destination and level of care, all while adhering to established protocols and standards of practice. Correct approach analysis. The correct approach involves a comprehensive interpretation of vital signs within the context of the patient's overall clinical presentation and mechanism of injury. This includes recognizing trends, understanding the interrelationship between different vital signs, e.g., heart rate and blood pressure, and correlating these findings with potential physiological derangements. For a CFRN, this aligns with the standards of care established by professional organizations such as the Board of Certification for Emergency Nursing, BCEN, and regulatory bodies governing advanced practice nursing in the United States. These standards emphasize a systematic approach to patient assessment, critical thinking, and evidence-based practice. Specifically, interpreting vital signs to identify signs of shock, hypoxemia, or neurological compromise is paramount for guiding immediate interventions and determining the urgency of transport. This approach ensures that the patient receives the most appropriate and timely care, minimizing preventable harm and optimizing outcomes, which is a core ethical and professional responsibility. Incorrect approach is analysis. Focusing solely on a single vital sign without considering the broader clinical picture is a significant regulatory and ethical failure. For instance, interpreting a slightly elevated heart rate in isolation, without accounting for pain, anxiety, or hypovolemia, can lead to misdiagnosis and delayed or inappropriate treatment. This violates the principle of holistic patient care and the requirement for comprehensive assessment mandated by nursing practice acts and professional standards. Another incorrect approach is to rely on preset numerical thresholds for intervention without considering the patient's baseline or the dynamic nature of their condition. This rigid adherence to numbers can overlook subtle but critical changes, potentially leading to misdiagnosis or undertreatment of serious conditions, which contravenes the ethical duty to provide individualized care and the regulatory expectation of skilled clinical judgment. Furthermore, ignoring the mechanism of injury when interpreting vital signs is a failure to apply a fundamental principle of trauma assessment, potentially leading to a misjudgment of the severity of internal injuries and inadequate preparation for the receiving facility. Professional reasoning. Professionals should employ a systematic approach to vital sign interpretation, beginning with a rapid primary survey to identify life-threatening conditions. This is followed by a secondary survey, which includes a detailed assessment of vital signs. The CFRN must then integrate these findings with the patient's history, mechanism of injury, and any observed signs and symptoms. A critical thinking framework such as the nursing process, assessment, diagnosis, planning, implementation, evaluation should guide decision-making. When interpreting vital signs, professionals should ask, what do these numbers tell me about the patient's physiological status, and what are the potential underlying causes? This involves considering differential diagnoses and anticipating potential complications. The decision-making process should also involve consulting established protocols and guidelines, and when in doubt, seeking assistance from medical control or more experienced colleagues. The ultimate goal is to ensure that interventions are evidence-based, patient-centered, and contribute to the best possible outcome. Question 6. Analysis of a 3-year-old male presenting with severe respiratory distress following a fall, characterized by audible stridor, suprasternal retractions, and a SpO2 of 85% on room air. The patient is conscious but lethargic. The flight nurse is en route to a specialized pediatric trauma center. Considering the pediatric airway considerations mandated by the Certified Flight Registered Nurse Regulatory Framework, which of the following represents the most appropriate initial airway management strategy? Option A. Initiate bag valve mask ventilation with 100% oxygen and administer a bronchodilator while awaiting further assessment by the receiving facility's medical team. Option B. Administer a nebulized racemic epinephrine and a dose of intravenous corticosteroids while continuing to monitor oxygen saturation with a non-rebreather mask. Option C. Prepare for and perform rapid sequence intubation with a supraglottic airway device, anticipating potential difficulty with direct laryngoscopy due to anatomical variations. Option D. Attempt immediate endotracheal intubation using a size 4.0 cuffed endotracheal tube, visualizing the vocal cords with a straight laryngoscope blade. The correct answer is B. Administer a nebulized racemic epinephrine and a dose of intravenous corticosteroids while continuing to monitor oxygen saturation with a non-rebreather mask. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the critical nature of pediatric airway management in a pre-hospital setting, the limited resources, potential for rapid deterioration, and the inherent anatomical differences in pediatric patients necessitate a highly skilled and informed approach. The flight nurse must quickly assess the situation, anticipate potential complications, and select the most appropriate airway intervention, all while considering the patient's age, size, and underlying pathology. The urgency of transport further compounds the challenge, demanding decisive action based on sound clinical judgment and adherence to established protocols. Correct approach analysis. The correct approach prioritizes a rapid, safe, and effective airway intervention that minimizes patient distress and optimizes oxygenation and ventilation. This involves a thorough assessment of the pediatric patient's airway, considering factors such as the presence of stridor, retractions, accessory muscle use, and oxygen saturation. Based on these findings, the flight nurse would select the most appropriate device and technique, which may include supraglottic airway insertion, or, in specific circumstances, endotracheal intubation, guided by established pediatric airway algorithms and the flight service's medical protocols. This approach aligns with the regulatory framework for certified flight registered nurses, which mandates adherence to evidence-based practice, patient safety, and the provision of advanced life support in the pre-hospital environment. Ethical considerations of beneficence and non-maleficence are paramount, ensuring the chosen intervention offers the greatest potential benefit with the least harm. Incorrect approaches analysis. One incorrect approach would be to delay definitive airway management due to uncertainty or reliance on less invasive methods that are insufficient for the patient's condition. This could lead to hypoxia, increased work of breathing, and potential cardiac arrest, violating the ethical principle of beneficence and potentially breaching regulatory requirements for timely and appropriate patient care. Another incorrect approach would be to attempt an airway intervention without adequate preparation or knowledge of pediatric anatomy and physiology, increasing the risk of complications such as esophageal intubation, vocal cord injury, or bronchospasm. This demonstrates a failure to adhere to professional standards of care and could be considered negligence. A third incorrect approach might involve using adult-sized equipment or techniques on a pediatric patient, which is inappropriate given the anatomical differences and could result in ineffective ventilation or airway trauma, again, contravening regulatory guidelines for pediatric care. Professional reasoning. Flight nurses should employ a systematic decision-making process that begins with a rapid primary survey to identify life threats, followed by a focused secondary survey to gather relevant history and perform a detailed physical examination, with particular attention to the airway. This assessment should be guided by pediatric-specific algorithms and protocols. The nurse must then consider the risks and benefits of each potential airway intervention, taking into account the patient's age, weight, clinical presentation, and the available equipment. Collaboration with the medical director and other team members is crucial, especially in complex cases. Continuous reassessment of the patient's airway and ventilation status is essential throughout transport, with a willingness to adapt the management strategy as needed. This structured approach ensures that patient safety remains the highest priority, and that care is delivered in accordance with regulatory and ethical standards. Question 7. The efficiency study reveals that a flight nurse is managing a pediatric patient experiencing severe bronchospasm. The physician has prescribed a bronchodilator. The nurse notes the patient is 8 years old, weighs 25 kg, and has a history of mild renal insufficiency. The nurse considers how the patient's age, weight, and renal function might influence the absorption, distribution, metabolism, and excretion of the medication, as well as the patient's unique response to its therapeutic effects and potential side effects. Which of the following approaches best reflects the nurse's application of pharmacokinetic and pharmacodynamic principles in this critical situation? Option A. Administer the prescribed dose of the bronchodilator, closely monitoring the patient for signs of improvement and any adverse reactions, and be prepared to adjust the dose or frequency based on the observed response and the patient's specific physiological parameters. Option B. Administer a higher dose of the bronchodilator than prescribed to ensure a rapid and potent bronchodilatory effect, given the severity of the bronchospasm. Option C. Administer a standard adult dose of the bronchodilator, assuming the medication will be equally effective and safe in a pediatric patient with renal insufficiency. Option D. Administer the prescribed dose of the bronchodilator and wait for the patient's condition to stabilize before considering any potential dose adjustments. The correct answer is A. Administer the prescribed dose of the bronchodilator, closely monitoring the patient for signs of improvement and any adverse reactions, and be prepared to adjust the dose or frequency based on the observed response and the patient's specific physiological parameters. Explanation. Scenario analysis. This scenario presents a common challenge in flight nursing, managing a patient with a critical condition requiring rapid and effective medication administration while operating in a dynamic and resource-constrained environment. The challenge lies in balancing the need for timely intervention with the inherent variability in patient response to medications, which is influenced by pharmacokinetic and pharmacodynamic principles. The flight nurse must anticipate potential complications and adjust treatment based on observed patient status, all while adhering to established protocols and ensuring patient safety. Correct approach analysis. The correct approach demonstrates a deep understanding of pharmacokinetics, how the body absorbs, distributes, metabolizes, and excretes a drug, and pharmacodynamics, how a drug affects the body. By considering the patient's age, weight, and renal function, the nurse is accounting for factors that significantly alter drug concentration and effect. This proactive assessment allows for a more precise initial dose and a heightened awareness of the need for vigilant monitoring and potential dose adjustments. This aligns with best professional practice by prioritizing patient-specific care, minimizing the risk of adverse events due to altered drug metabolism or excretion, and ensuring therapeutic efficacy. Regulatory frameworks for flight nursing emphasize individualized patient care and the application of evidence-based practice, which includes understanding and applying pharmacokinetic and pharmacodynamic principles to optimize medication management. Incorrect approaches analysis. One incorrect approach involves administering a standard adult dose without considering the patient's specific physiological characteristics. This fails to account for potential differences in drug metabolism and excretion in pediatric or elderly patients, or those with compromised renal function. This could lead to subtherapeutic levels or, more critically, toxic accumulation of the drug, violating the ethical principle of do no harm and potentially contravening regulations that mandate appropriate dosing based on patient factors. Another incorrect approach is to rely solely on the initial prescribed dose and not adjust based on the patient's response. Pharmacodynamics dictates that the patient's individual response to a drug can vary. Failing to monitor for therapeutic effects and adverse reactions, and not titrating the medication accordingly, ignores the dynamic nature of drug action and patient physiology. This can result in prolonged illness, inadequate pain control, or the development of serious side effects, which is a failure in professional duty of care and may violate protocols requiring ongoing patient assessment and intervention. A third incorrect approach is to administer a higher dose than prescribed to ensure a rapid effect, without a clear clinical indication or protocol support. This is a direct violation of medication administration protocols and can lead to unpredictable and potentially dangerous pharmacodynamic effects, including overdose and severe adverse reactions. This action demonstrates a lack of adherence to established guidelines and a disregard for patient safety, representing a significant ethical and regulatory breach. Professional reasoning. Flight nurses must employ a systematic approach to medication administration. This involves a thorough patient assessment, including understanding the patient's medical history and current physiological status. They must then critically evaluate the prescribed medication, considering its pharmacokinetic and pharmacodynamic properties in the context of the individual patient. This includes anticipating potential drug interactions, understanding the expected onset, peak, and duration of action, and recognizing signs of both therapeutic efficacy and adverse effects. Continuous monitoring and a willingness to adjust the treatment plan based on the patient's evolving condition are paramount. Decision-making should be guided by established protocols, evidence-based practice, and a commitment to patient safety, always prioritizing the least invasive and most effective intervention. Question 8. Benchmark analysis indicates that a critically ill patient being prepared for aeromedical transport exhibits a urine output of 20 ml/hour over the last 2 hours, a serum creatinine of 1.8 mg/dl, and a blood pressure of 105/60 mmHg. The patient has a history of chronic kidney disease. Which of the following approaches to assessing the patient's renal status during the flight is most appropriate for a certified flight registered nurse? Option A. Rely on the patient's baseline renal function as documented in their medical record and only intervene if vital signs become unstable during transport. Option B. Focus primarily on maintaining adequate blood pressure through vasopressor support and monitor urine output hourly, adjusting fluid administration based on perceived hydration status. Option C. Administer a bolus of intravenous fluids and a diuretic to increase urine output, assuming the low output is solely due to dehydration, and monitor vital signs. Option D. Initiate a comprehensive renal assessment including evaluation of urine-specific gravity, presence of edema, assessment of lung sounds for crackles, and review of recent electrolyte panels, in addition to monitoring blood pressure and urine output. The correct answer is B. Focus primarily on maintaining adequate blood pressure through vasopressor support and monitor urine output hourly, adjusting fluid administration based on perceived hydration status. Explanation. This scenario presents a professionally challenging situation due to the critical nature of renal function in critically ill patients, particularly those requiring air transport. Flight nurses must rapidly assess and manage patients with potential or actual renal compromise, where physiological changes during flight can exacerbate existing conditions or precipitate new ones. The challenge lies in synthesizing complex clinical data, understanding the impact of altitude and environmental factors on renal hemodynamics, and making timely, evidence-based interventions within the constraints of an aeromedical environment. Careful judgment is required to differentiate between normal physiological responses to flight and signs of worsening renal dysfunction, ensuring patient safety and optimal outcomes. The correct approach represents best professional practice because it prioritizes a comprehensive, systematic, and evidence-based assessment of renal function in the context of the patient's overall clinical status and the aeromedical environment. This aligns with the core principles of flight nursing, which demand a high level of clinical acumen and the ability to anticipate and manage patient needs under dynamic conditions. Adherence to established protocols and guidelines for renal assessment in critically ill patients, adapted for the aeromedical setting, ensures that all relevant parameters are considered, leading to accurate diagnosis and effective management. This approach is ethically sound, fulfilling the nurse's duty of care and commitment to patient well-being. Regulatory frameworks for flight nursing emphasize the importance of thorough patient assessment and the application of specialized knowledge to ensure safe patient transport. An incorrect approach that focuses solely on urine output without considering other indicators of renal perfusion and function is professionally unacceptable. Urine output is a lagging indicator and can be influenced by factors other than intrinsic renal function, such as fluid administration, diuretic use, and patient positioning. Relying solely on this parameter can lead to delayed recognition of significant renal impairment, violating the nurse's duty to monitor and intervene promptly. This failure to conduct a comprehensive assessment constitutes a breach of professional standards and potentially violates regulatory requirements for patient care. Another incorrect approach that neglects to consider the impact of altitude on renal hemodynamics is also professionally unsound. Changes in barometric pressure and oxygen saturation during flight can directly affect renal blood flow and glomerular filtration rate. Ignoring these environmental factors can lead to misinterpretation of assessment findings and inappropriate management decisions, potentially compromising patient safety. This oversight demonstrates a lack of specialized knowledge required for aeromedical nursing and may contravene guidelines that mandate consideration of environmental influences on patient physiology. A third incorrect approach that relies on anecdotal experience rather than current evidence-based guidelines for renal assessment in critically ill patients is ethically and professionally problematic. While experience is valuable, it must be grounded in up-to-date knowledge and best practices. Failure to consult and apply current evidence-based protocols for renal assessment can result in outdated or suboptimal care, potentially leading to adverse patient outcomes. This approach risks deviating from established standards of care and may not meet the regulatory expectations for competent and current practice. The professional decision-making process for similar situations should involve a structured approach. First, rapidly gather all available patient data, including vital signs, laboratory results, and clinical history. Second, consider the specific physiological stressors of aeromedical transport, such as altitude, vibration, and temperature, and their potential impact on renal function. Third, systematically assess key indicators of renal perfusion and function, including urine output, serum creatinine and BUN, electrolytes, and signs of fluid overload or deficit. Fourth, consult and apply relevant, current evidence-based protocols for renal assessment and management in critically ill patients, adapting them as necessary for the aeromedical environment. Finally, communicate findings and proposed interventions clearly with the medical team and make timely, informed decisions to ensure patient safety and optimize outcomes. Question 9. What factors determine the most appropriate medication administration route for a critically ill patient during interfacility transport, considering the unique environmental and physiological challenges of flight nursing? Option A. The flight nurse's personal experience with different medication administration routes. Option B. The preference of the referring or receiving facility's pharmacy department. Option C. The availability of specific medication delivery devices on the aircraft. Option D. Patient's current physiological status, the urgency of the therapeutic need, and the medication's pharmacokinetic properties. The correct answer is D. Patient's current physiological status, the urgency of the therapeutic need, and the medication's pharmacokinetic properties. Explanation. Scenario analysis. Administering medications to a critically ill patient in a pre-hospital or interfacility transport setting presents significant challenges. The flight environment introduces unique stressors, including vibration, noise, limited space, and potential for rapid patient deterioration. The choice of medication administration route directly impacts the speed of onset, bioavailability, and potential for adverse effects, all of which are amplified in this dynamic environment. A misjudgment in route selection can lead to delayed therapeutic effect, increased risk of complications, or an inability to effectively manage the patient's condition, directly impacting patient safety and outcomes. Correct approach analysis. The correct approach prioritizes patient-specific factors and the clinical indication for the medication. This involves a thorough assessment of the patient's current physiological status, including their level of consciousness, hemodynamic stability, vascular access, and the urgency of the therapeutic need. For instance, if rapid onset is critical for a life-threatening condition like anaphylaxis or cardiac arrest, an intravenous, Roman 4, route is generally preferred due to its immediate bioavailability. If Roman 4 access is difficult or not yet established, intramuscular IM or subcutaneous SC routes may be considered, understanding their slower absorption rates. The specific properties of the medication itself, such as its solubility, stability, and potential for irritation, also dictate the most appropriate route. Adherence to established protocols and standing orders for specific patient populations and clinical scenarios is paramount, ensuring evidence-based practice and consistent care. This approach aligns with the principles of patient-centered care and the professional responsibility to select the safest and most effective means of medication delivery. Incorrect approaches analysis. Selecting a medication administration route based solely on the nurse's personal preference or familiarity, without considering the patient's condition or the medication's pharmacokinetics, represents a significant professional and ethical failure. This approach disregards the fundamental principles of safe medication administration and patient safety. Relying exclusively on a single, preferred route, such as always opting for oral administration when other routes are more appropriate for rapid effect, can lead to delayed treatment and potentially irreversible harm. Similarly, choosing a route that is contraindicated for the patient's current condition, e.g., IM injection in a patient with severe coagulopathy, introduces an unacceptable risk of complications. Failure to consult or adhere to established protocols for medication administration in critical care or transport settings constitutes a breach of professional standards and may violate regulatory guidelines governing flight nursing practice. This demonstrates a lack of critical thinking and a failure to apply evidence-based practice. Professional reasoning. Flight-registered nurses must employ a systematic decision-making process when selecting medication administration routes. This process begins with a comprehensive patient assessment, followed by identification of the therapeutic goal and the urgency of achieving it. Next, the nurse must consider the available medication routes, their pharmacokinetic profiles, and the patient's physiological status and any contraindications. Consultation with medical direction or adherence to pre-approved protocols is essential. Finally, the nurse must anticipate potential complications and have a plan for monitoring the patient's response and managing adverse effects. This iterative process ensures that the chosen route is the safest, most effective, and most appropriate for the specific patient and clinical situation. Question 10. Strategic planning requires the certified flight-registered nurse to select the most appropriate technique for endotracheal intubation in a critically ill patient during aeromedical transport. Considering the regulatory framework and best practices for flight nursing in the United States, which of the following approaches best exemplifies a safe and effective decision-making process for airway management? Option A. Relying solely on the patient's chest rise as the primary indicator of successful endotracheal tube placement after insertion. Option B. Proceeding with a blind nasal intubation if initial attempts with direct laryngoscopy are unsuccessful, without further assessment of the patient's anatomy or contraindications. Option C. Prioritizing techniques that offer direct visualization of the vocal cords, such as video laryngoscopy, and ensuring immediate confirmation of tube placement through auscultation and end-tidal CO2 monitoring. Option D. Administering sedatives and paralytics without confirming the patient's airway patency or the need for intubation, based on the assumption of impending respiratory arrest. Correct answer is C. Prioritizing techniques that offer direct visualization of the vocal cords, such as video laryngoscopy, and ensuring immediate confirmation of tube placement through auscultation and end-tidal CO2 monitoring. Explanation. Scenario analysis. This scenario is professionally challenging due to the critical nature of airway management in a pre-hospital, potentially unstable environment. A flight-registered nurse, FRN, must make rapid life-sustaining decisions under pressure, with limited resources and potentially compromised patient conditions. The urgency of the situation, coupled with the need for precise technique and adherence to established protocols, demands a high level of clinical judgment and skill. The potential for patient harm from delayed or incorrect intubation is significant, making the choice of technique paramount. Correct approach analysis. The correct approach involves selecting the intubation technique that offers the highest likelihood of successful first-pass intubation, minimizes patient distress and physiological compromise, and aligns with established flight-registered nurse protocols and guidelines. This typically means prioritizing techniques that provide direct visualization of the vocal cords and allow for rapid confirmation of tube placement. In the context of U.S. aviation regulations and nursing practice, this would involve utilizing direct laryngoscopy or video laryngoscopy, as these methods are standard of care and supported by evidence-based practice for achieving successful endotracheal intubation. The emphasis is on a systematic, evidence-based approach to secure the airway efficiently and safely. Incorrect approaches analysis. Employing a technique that relies solely on indirect visualization or blind insertion without direct confirmation of vocal cord visualization would be a significant regulatory and ethical failure. For instance, attempting a blind nasal intubation without prior assessment of contraindications or without immediate confirmation of tube placement in the trachea would violate the FRN's duty of care and potentially breach established nursing standards of practice. Such an approach increases the risk of esophageal intubation, leading to hypoxia, delayed definitive airway management, and potential patient harm. Furthermore, failing to utilize available technology like video laryngoscopy when indicated and available would represent a deviation from best practices and could be considered a failure to provide the highest standard of care, potentially violating guidelines set forth by aviation medical authorities and professional nursing organizations. Professional reasoning. Professionals should utilize a structured decision-making framework that begins with a rapid assessment of the patient's airway and the need for intubation. This assessment should consider the patient's physiological status, potential for airway compromise, and the environment. Next, the FRN should review available equipment and their proficiency with different techniques. The decision should then be guided by evidence-based practice, institutional protocols, and patient-specific factors. A critical component is the ability to anticipate and manage potential complications, having backup plans and equipment readily available. Continuous assessment of tube placement and patient response is essential post-intubation. Question 11. Regulatory review indicates a flight nurse is dispatched to a motor vehicle collision. Upon arrival, the patient is found unresponsive at the scene, approximately 20 feet from the vehicle. EMS reports the patient was ejected from the driver's side window. The patient exhibits significant facial lacerations and bruising. What is the most critical initial consideration for the flight nurse regarding the mechanism of injury and its implications for patient management? Option A. The primary goal is rapid transport to the nearest hospital, and a detailed assessment of the mechanism can be deferred until arrival at the facility. Option B. The high-velocity impact associated with ejection suggests a high likelihood of severe head, cervical spine, and internal injuries, necessitating immediate airway management, cervical spine stabilization, and rapid transport to a trauma center. Option C. The patient's unresponsiveness is likely due to a pre-existing medical condition, and the facial trauma is a secondary consequence of the fall. Option D. The visible facial trauma is the most significant injury, and management should focus on controlling bleeding and assessing for dental avulsions. Correct answer is B. The high-velocity impact associated with ejection suggests a high likelihood of severe head, cervical spine, and internal injuries, necessitating immediate airway management, cervical spine stabilization, and rapid transport to a trauma center. Explanation. Scenario analysis. This scenario presents a common challenge in flight nursing, rapidly assessing a trauma patient with limited initial information and determining the most likely mechanism of injury to guide immediate interventions and anticipate potential injuries. The flight nurse must synthesize the dispatch information, patient presentation, and environmental factors to form a working diagnosis and treatment plan, all while operating in a dynamic and resource-constrained environment. The urgency of the situation and the need for accurate, timely decision-making underscore the professional challenge. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's presentation in conjunction with the reported circumstances of the incident. For a patient found unresponsive with significant facial trauma and a history of being ejected from a vehicle, considering a high-velocity impact and potential for severe head, cervical, spine, and internal injuries is paramount. This aligns with established trauma protocols and the understanding that mechanisms of injury directly correlate with injury patterns. Prioritizing airway management, cervical spine stabilization, and rapid transport to a trauma center are critical interventions dictated by this assessment, reflecting best professional practice as outlined in flight nursing standards of care and trauma resuscitation guidelines. Incorrect approaches analysis. Focusing solely on the immediate finding of facial trauma without considering the mechanism of ejection is a significant regulatory and ethical failure. It risks overlooking life-threatening injuries such as intracranial hemorrhage or cervical spine fractures, which are highly probable given the mechanism. This narrow focus deviates from the comprehensive trauma assessment required by flight nursing protocols. Attributing the unresponsiveness solely to a pre-existing medical condition without thoroughly investigating the trauma mechanism is another failure. While pre-existing conditions are a consideration, the violent nature of the ejection strongly suggests trauma as the primary cause of unresponsiveness. This oversight could lead to delayed or inappropriate treatment, violating the duty of care. Prioritizing immediate transport without a brief, focused assessment of the mechanism and potential injuries is also problematic. While rapid transport is often indicated in trauma, it must be informed by an understanding of the likely injuries to ensure the patient receives the most appropriate initial care en route and at the receiving facility. This approach lacks the critical analytical step of linking mechanism to injury. Professional reasoning. Flight nurses must employ a structured decision-making process that begins with a thorough understanding of the dispatch information and the patient's initial presentation. This involves actively considering the mechanism of injury as a primary driver of potential trauma. The next step is to perform a rapid, systematic assessment, prioritizing life threats according to established protocols, e.g., UPDET. This assessment should then inform the selection of interventions and the determination of the most appropriate destination facility. Continuous reassessment and adaptation of the treatment plan based on the patient's response are also crucial. In essence, the process is dispatch information, mechanism of injury analysis, rapid primary survey intervention selection, destination determination, ongoing reassessment. Question 12. Strategic planning requires certified flight-registered nurses to evaluate various advanced airway management techniques for critically ill patients during helicopter transport. Considering the unique challenges of the pre-hospital environment, which approach best aligns with regulatory expectations and ethical patient care when faced with a deteriorating patient requiring immediate airway intervention. Option A. Delaying definitive airway management until the patient is stabilized by other means, even if signs of significant respiratory compromise are present. Option B. Relying on the subjective judgment of the most senior crew member to determine the appropriate airway intervention without a formal assessment process. Option C. Conducting a rapid, systematic assessment of the patient's airway, breathing, and circulation, considering the least invasive effective airway intervention first, and escalating as necessary based on evidence-based protocols. Option D. Immediately proceeding with the most advanced airway technique available, assuming the patient's condition warrants it without further assessment. The correct answer is D. Immediately proceeding with the most advanced airway technique available, assuming the patient's condition warrants it without further assessment. Explanation. Scenario analysis. This scenario is professionally challenging due to the critical nature of advanced airway management in a pre-hospital flight environment. Rapid patient deterioration, limited resources, and the inherent risks of invasive procedures necessitate swift, evidence-based decision-making. The flight nurse must balance the urgency of the situation with the need for a safe and effective intervention, considering patient factors, available equipment, and the potential for complications. Correct approach analysis. The correct approach emphasizes a systematic, evidence-based assessment and intervention strategy. This aligns with the regulatory framework for certified flight-registered nurses, which mandates adherence to established protocols and best practices in patient care. Prioritizing patient safety through a thorough assessment, appropriate equipment selection, and skilled execution of the chosen airway technique represents best professional practice. This approach is ethically sound, prioritizing patient well-being and minimizing harm. It also reflects the professional responsibility to maintain competency in advanced procedures. Incorrect approach is analysis, an approach that bypasses a thorough patient assessment and immediately proceeds to a more invasive airway technique without clear indication or consideration of less invasive options, represents a failure to adhere to established clinical guidelines and potentially violates patient safety standards. This could be considered negligent care, an approach that relies solely on the most experienced team members' intuition, without a structured assessment or consideration of alternative techniques, even if the outcome is successful, fails to establish a reproducible and defensible standard of care. This approach lacks the systematic rigor required by regulatory bodies and can lead to inconsistent patient outcomes. An approach that delays definitive airway management due to indecision or an over-reliance on less effective interventions, when a clear need for advanced airway management exists, can lead to patient harm through hypoxia and increased morbidity. This failure to act decisively when indicated constitutes a breach of professional duty and potentially violates patient care standards. Professional reasoning. Professionals should employ a decision-making framework that begins with a rapid, yet comprehensive, patient assessment. This includes evaluating the patient's airway, breathing, and circulation, ABCs, identifying the underlying cause of respiratory distress, and determining the need for advanced airway management. The next step involves considering the most appropriate airway intervention based on the patient's condition, available equipment, and the expertise of the team, always prioritizing the least invasive effective method. This decision-making process should be guided by current evidence-based guidelines and institutional protocols. Continuous reassessment and adaptation of the plan are crucial throughout the transport. Question 13. The risk matrix shows a high likelihood of respiratory compromise and a moderate severity of potential sequelae for a patient experiencing sudden onset dyspnea and hypoxia during air transport. Which of the following critical care assessment approaches best addresses this situation? Option A. Prioritize immediate administration of high-flow oxygen and initiate a focused assessment of the patient's airway, breathing, and circulation, while simultaneously obtaining a brief but relevant history from the patient or accompanying personnel. Option B. Rely on the patient's reported sensation of dyspnea as the primary indicator of severity and adjust oxygen therapy based solely on their subjective feedback. Option C. Focus on administering pain medication to alleviate the patient's distress, as discomfort can exacerbate respiratory symptoms, and reassess vital signs in 15 minutes. Option D. Conduct a complete head-to-toe physical examination, including detailed neurological and abdominal assessments, before initiating any significant interventions for the respiratory distress. The correct answer is A. Prioritize immediate administration of high-flow oxygen and initiate a focused assessment of the patient's airway, breathing, and circulation, while simultaneously obtaining a brief but relevant history from the patient or accompanying personnel. Explanation. This scenario is professionally challenging because the flight nurse must rapidly assess a critically ill patient in a dynamic and resource-limited environment, where the risk of deterioration is high and immediate intervention is crucial. The risk matrix, while a conceptual tool, highlights the need for a systematic approach to prioritize interventions based on the likelihood and severity of potential adverse events. The correct approach represents best professional practice because it aligns with established critical care nursing standards and regulatory guidelines for flight nursing. Comprehensive, head-to-toe assessment, integrated with ongoing physiological monitoring and a thorough understanding of the patient's underlying pathology, allows for the identification of subtle changes that may indicate impending decompensation. This systematic evaluation, coupled with a proactive approach to risk mitigation, ensures that interventions are timely and evidence-based, thereby minimizing patient harm and optimizing outcomes. This aligns with the ethical imperative to provide competent and safe patient care, as mandated by nursing practice acts and professional standards of care. An incorrect approach that relies solely on a single vital sign or symptom is professionally unacceptable. This fails to acknowledge the complexity of critical illness and the potential for multiple, interacting physiological derangements. Such an approach risks overlooking critical clues, leading to delayed or inappropriate interventions, which constitutes a breach of the standard of care and potentially violates ethical principles of beneficence and non-maleficence. Similarly, an approach that prioritizes comfort measures over definitive assessment and intervention in a critically unstable patient is ethically flawed. While patient comfort is important, it must not supersede the immediate need to stabilize the patient and address life-threatening conditions. This could be seen as a failure to uphold the duty of care and a deviation from professional nursing responsibilities in a critical care setting. Professionals should employ a structured decision-making process that begins with a rapid initial assessment to identify immediate life threats. This is followed by a systematic and comprehensive assessment, incorporating both subjective and objective data. Continuous reassessment and monitoring are paramount, allowing for adaptation of the care plan as the patient's condition evolves. Collaboration with the medical team and adherence to established protocols and guidelines are essential components of safe and effective flight nursing practice. Question 14. Benchmark analysis indicates that a certified flight registered nurse, CFRN, is tasked with managing the airway of a patient experiencing significant facial trauma and a declining level of consciousness during air medical transport. The patient exhibits audible stridor and intermittent gurgling sounds. Which of the following actions best reflects adherence to regulatory requirements and best practices for airway assessment and monitoring in this scenario? Option A. Immediately attempting endotracheal intubation without further assessment of airway patency. Option B. Assessing airway patency, utilizing airway adjuncts as needed, and preparing for advanced airway interventions if initial measures are insufficient. Option C. Performing a rapid sequence intubation, RSI, based on the declining level of consciousness alone. Option D. Administering a sedative to facilitate a more thorough examination of the airway. Correct answer is D. Administering a sedative to facilitate a more thorough examination of the airway. Explanation. Scenario analysis. A certified flight registered nurse, CFRN, responding to a scene with a critically injured patient presenting with altered mental status and signs of airway compromise faces a significant professional challenge. The urgency of the situation, potential for rapid deterioration, and the need for immediate, effective airway management under potentially austere conditions demand precise clinical judgment. The CFRN must balance the immediate need for airway control with the risks associated with various interventions, all while adhering to established protocols and patient safety standards. Correct approach analysis. The correct approach involves a systematic assessment of the airway, prioritizing interventions based on the patient's condition and the CFRN scope of practice, as defined by relevant U.S. aviation and nursing regulations. This includes utilizing the ABDE approach, airway, breathing, circulation, disability, exposure, to identify and address immediate life threats. For airway management, this means assessing for patency, signs of obstruction e.g. stridor, gurgling, paradoxical chest movement, and the ability to protect their own airway e.g. gag reflex, level of consciousness. Based on these findings, the CFRN would select the least invasive yet most effective intervention, which might range from positioning and suctioning to the use of an airway adjunct or, if indicated and within their skill set and medical direction, advanced airway management. This aligns with the Federal Aviation Administration (FAA) regulations concerning medical care provided in the pre-hospital and transport environment, as well as the nursing scope of practice outlined by the relevant state's Board of Nursing and Professional Standards set by organizations like the Board of Certification for Emergency Nursing, BCEN, for CFRN certification. The emphasis is on evidence-based practice and patient advocacy, ensuring the patient receives appropriate care without undue delay or risk. Incorrect approaches analysis. One incorrect approach would be to immediately proceed with an invasive airway procedure without a thorough assessment of the patient's current airway status and the potential for less invasive interventions. This could lead to unnecessary patient harm, such as esophageal intubation or trauma, and violates the principle of do no harm, non-maleficence, a cornerstone of nursing ethics and regulatory compliance. Another incorrect approach would be to delay definitive airway management due to uncertainty or a desire to wait for physician orders when the patient's condition clearly indicates an emergent need, potentially violating the CFRN duty to act and the patient's right to timely care. This could also be seen as a failure to adhere to established protocols for emergency airway management, which are often guided by medical direction and pre-approved treatment algorithms. Furthermore, relying solely on a single assessment parameter without considering the broader clinical picture, e.g., focusing only on oxygen saturation without assessing for actual airway patency, is a failure of comprehensive assessment, which is a regulatory requirement for safe nursing practice. Professional reasoning. Professionals should employ a structured decision-making process, beginning with a rapid, systematic assessment of the patient's airway. This involves utilizing established mnemonics like "de" and considering the patient's mechanism of injury and presenting signs and symptoms. The CFRN must then critically evaluate the available interventions, considering their efficacy, risks, and their own competency and scope of practice, always guided by medical direction and established protocols. This iterative process of assessment, intervention, and reassessment is crucial for adapting to the dynamic nature of critical care transport and ensuring optimal patient outcomes while maintaining regulatory compliance and ethical standards. Question 15. Compliance review shows that during a recent aeromedical transport, a flight-registered nurse was presented with a 12-lead ECG from a patient experiencing chest pain. The nurse needs to quickly and accurately assess the ECG to guide immediate patient management. Which approach to ECG interpretation best aligns with regulatory expectations for a certified flight-registered nurse in this critical scenario? Option A. Rely exclusively on the automated interpretation provided by the ECG machine, as it is designed to detect all significant cardiac events. Option B. Postpone a detailed ECG interpretation until after the patient has been transferred to the receiving facility to avoid making premature clinical decisions. Option C. Primarily focus on the rhythm strip provided, as this is usually sufficient for identifying the most critical cardiac issues during transport. Option D. Systematically analyze all 12 leads of the ECG, evaluating rate, rhythm, axis, intervals, and morphology for any abnormalities, and correlate findings with the patient's clinical status. The correct answer is D. Systematically analyze all 12 leads of the ECG, evaluating rate, rhythm, axis, intervals, and morphology for any abnormalities, and correlate findings with the patient's clinical status. Explanation. Scenario analysis. A flight-registered nurse, FRN, is tasked with interpreting a 12-lead ECG from a critically ill patient during transport. The challenge lies in the dynamic nature of patient conditions in an aeromedical environment, where rapid and accurate interpretation is crucial for timely intervention and patient stabilization. The limited resources, potential for artifact, and the need to communicate findings effectively to a remote medical team add layers of complexity. Misinterpretation can lead to delayed or inappropriate treatment, directly impacting patient outcomes and potentially violating patient care standards. Correct approach analysis. The correct approach involves a systematic, step-by-step interpretation of the ECG, prioritizing the identification of life-threatening arrhythmias and ischemic changes. This aligns with established nursing practice standards and the implicit duty of care for FRNs to provide competent patient assessment and management. A structured approach ensures all critical components of the ECG are evaluated, minimizing the risk of overlooking significant findings. This methodical process is essential for making informed clinical decisions within the scope of practice for a registered nurse in an aeromedical setting, adhering to the principles of patient safety and evidence-based practice. Incorrect approaches analysis. One incorrect approach is to focus solely on rhythm strips without analyzing the full 12 leads, as this can miss subtle but critical findings like ST segment changes, indicative of myocardial infarction, that may not be apparent on a single lead. This failure to conduct a comprehensive assessment violates the standard of care expected of a registered nurse. Another incorrect approach is to rely on automated ECG interpretation software without independent clinical correlation. While software can be a helpful tool, it is not a substitute for professional nursing judgment and can generate false positives or negatives, leading to diagnostic errors. This over-reliance on technology without critical appraisal can be considered a breach of professional responsibility. A third incorrect approach is to delay interpretation until the patient's condition significantly deteriorates, assuming the current ECG is stable. This reactive approach is contrary to the proactive nature of critical care and aeromedical transport, where early identification of changes is paramount. It can lead to missed opportunities for timely intervention, potentially violating patient advocacy and the duty to provide prompt care. Professional reasoning. FRNs must employ a systematic approach to ECG interpretation, integrating the ECG findings with the patient's clinical presentation, vital signs, and history. This involves a structured review of rate, rhythm, axis, intervals, and morphology, specifically looking for abnormalities that require immediate intervention. When faced with uncertainty or complex findings, consulting with a physician or a more experienced medical professional is a critical step in the decision-making process, ensuring patient safety and adherence to best practices. Question 16. Market research demonstrates that flight-registered nurses are increasingly encountering patients with complex respiratory conditions in pre-hospital settings. When initiating mechanical ventilation for a patient experiencing acute respiratory distress syndrome (ARDS) with suspected increased intracranial pressure, which ventilation strategy best optimizes gas exchange while minimizing the risk of further neurological compromise and lung injury? Option A. Employ a lung-protective ventilation strategy focusing on achieving adequate minute ventilation by adjusting tidal volume to 6-8 ml/kg ideal body weight and a respiratory rate that maintains normic apnea, while carefully monitoring for signs of increased intracranial pressure. Option B. Ventilate the patient with a rapid respiratory rate of 30-35 breaths per minute and a low tidal volume to minimize intrathoracic pressure and prevent CO2 retention, even if it leads to mild hypoxemia. Option C. Focus solely on maintaining an SpO2 above 95% by increasing the fraction of inspired oxygen and adjusting the respiratory rate as needed, without specific attention to tidal volume or end-tidal CO2. Option D. Initiate ventilation with a high tidal volume of 10-12 ml/kg ideal body weight to ensure rapid CO2 clearance and improve oxygenation, accepting a higher risk of barotrauma. The correct answer is A. Employ a lung-protective ventilation strategy focusing on achieving adequate minute ventilation by adjusting tidal volume to 6-8 ml/kg ideal body weight and a respiratory rate that maintains normic apnea, while carefully monitoring for signs of increased intracranial pressure. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a flight-registered nurse to rapidly assess a critically ill patient experiencing respiratory distress in a dynamic and resource-limited environment. The decision-making process must prioritize patient safety and optimal physiological support while adhering to established protocols and available equipment. The urgency of the situation, coupled with the potential for rapid deterioration, necessitates a deep understanding of ventilation principles and their application in a pre-hospital setting. Correct approach analysis. The correct approach, focusing on optimizing tidal volume and respiratory rate to achieve adequate minute ventilation while minimizing barotrauma, represents best professional practice. This aligns with established critical care guidelines and flight nursing standards of care, which emphasize individualized patient management. The goal is to provide sufficient oxygenation and carbon dioxide removal without causing lung injury. This approach is ethically grounded in the principle of beneficence, ensuring the patient receives the most appropriate and least harmful ventilation strategy. Regulatory frameworks for flight nursing often mandate adherence to evidence-based practices and protocols that support such individualized, physiologically driven ventilation. Incorrect approaches analysis. Implementing a fixed, high tidal volume ventilation strategy without considering patient-specific factors or lung mechanics risks causing volatrauma and barotrauma, potentially exacerbating lung injury. This violates the ethical principle of non-maleficence and contravenes regulatory guidelines that promote lung-protective ventilation. Utilizing a ventilation strategy solely focused on achieving a specific SpO2 target without adequate consideration for ventilation, CO2 clearance, can lead to hypercapnia, which can have detrimental effects on cerebral perfusion and acid-base balance. This demonstrates a failure to provide comprehensive physiological support and may fall short of regulatory requirements for holistic patient care. Adopting a ventilation strategy that prioritizes patient comfort over adequate gas exchange, such as allowing significant patient effort against the ventilator without appropriate support, can lead to increased work of breathing, hypoxemia, and hypercapnia. This neglects the primary responsibility of the flight nurse to ensure adequate physiological support and may be considered a deviation from accepted standards of care. Professional reasoning: flight-registered nurses should employ a systematic approach to ventilation management. This involves initial assessment of the patient's respiratory status, including airway patency, breath sounds, and oxygen saturation. Based on this assessment, the nurse should select an initial ventilation strategy that aims for adequate gas exchange while minimizing the risk of lung injury. Continuous monitoring of the patient's response to ventilation, including vital signs, end-tidal CO2 and blood gases, if available, is crucial. Adjustments to tidal volume, respiratory rate, and positive end expiratory pressure, PEEP, should be made iteratively to optimize oxygenation and ventilation, guided by patient response and established protocols. This decision-making process is iterative and patient-centered, ensuring that ventilation strategies are dynamic and responsive to the patient's evolving condition. Question 17. System analysis indicates a patient is being prepared for air medical transport due to acute respiratory distress. The referring team provides a brief verbal report stating the patient is struggling to breathe and has been placed on supplemental oxygen. As the certified flight-registered nurse, what is the most appropriate initial action regarding the patient's respiratory status prior to initiating transport? Option A. Immediately initiate endotracheal intubation to secure the airway, given the report of respiratory distress. Option B. Delay transport to perform an extensive diagnostic workup, including chest X-ray and arterial blood gas analysis, before moving the patient. Option C. Proceed with transport based on the referring team's report, assuming their assessment is complete and accurate. Option D. Conduct a comprehensive respiratory assessment, including auscultation of lung sounds, observation of work of breathing, and assessment of oxygen saturation and end-tidal CO2 if available, to guide immediate interventions and transport decisions. The correct answer is D. Conduct a comprehensive respiratory assessment, including auscultation of lung sounds, observation of work of breathing, and assessment of oxygen saturation and end-tidal CO2 if available, to guide immediate interventions and transport decisions. Explanation: scenario analysis. This scenario presents a professional challenge due to the inherent conflict between immediate patient need and the established protocols for patient transfer, particularly when dealing with a potentially deteriorating respiratory status. The flight nurse must balance the urgency of the situation with the requirement for a comprehensive assessment and documentation, all within the time constraints of a critical care transport. The ethical imperative to provide the best possible care for the patient clashes with the procedural requirements that ensure patient safety and continuity of care. Correct approach analysis. The correct approach prioritizes a thorough, systematic respiratory assessment, including auscultation, observation of work of breathing, and assessment of oxygen saturation and end-tidal CO2 if available. This aligns with best professional practice for certified flight-registered nurses as mandated by the National Association of Flight Nurse (NAFN) guidelines and the flight nurse scope of practice. These frameworks emphasize the critical importance of a comprehensive initial assessment to identify the severity of respiratory distress, guide immediate interventions, and inform the decision-making process regarding the need for advanced airway management or other critical treatments prior to or during transport. This detailed assessment ensures that the patient's physiological status is accurately understood, allowing for evidence-based interventions and safe patient management throughout the transport. Incorrect approaches analysis. One incorrect approach would be to immediately initiate advanced airway management without a thorough initial respiratory assessment. This bypasses crucial diagnostic steps, potentially leading to unnecessary interventions, increased patient risk, and failure to identify the underlying cause of the respiratory distress. It violates the principle of do no harm and deviates from evidence-based practice, as interventions should be guided by a clear understanding of the patient's condition. Another incorrect approach would be to rely solely on the referring facility's report without independent verification. While the report provides valuable information, it is not a substitute for the flight nurse's own assessment. Over-reliance on the report can lead to missed critical findings or misinterpretations of the patient's current status, potentially resulting in delayed or inappropriate care. This fails to uphold the flight nurse's professional responsibility for independent patient assessment and critical decision-making. A third incorrect approach would be to delay transport to conduct an overly lengthy and detailed assessment that is not immediately critical to stabilizing the patient's respiratory status. While thoroughness is important, the flight nurse must also consider the dynamic nature of critical illness and the need for timely intervention and transport to definitive care. This approach could compromise the patient's outcome by delaying access to higher levels of care. Professional reasoning. Flight nurses must employ a structured approach to patient assessment, integrating their knowledge of pathophysiology, critical care principles, and regulatory guidelines. This involves a rapid yet comprehensive initial assessment, followed by ongoing reassessment and intervention based on the patient's response. The decision-making process should be guided by a hierarchy of needs, prioritizing immediate life threats, and then proceeding with more detailed assessments and interventions as the patient's condition allows and as dictated by the transport environment and available resources. Adherence to established protocols and ethical principles ensures patient safety and optimal outcomes. Question 18. The control framework reveals that a critically ill patient requiring mechanical ventilation is being prepared for air medical transport. The CFRN must select the most appropriate initial ventilator strategy, considering the patient's known history of severe asthma and current presentation of bronchospasm. Which of the following approaches best aligns with the principles of safe and effective mechanical ventilation in this context? Option A. Apply standard adult ventilation settings without significant modification, assuming the bronchospasm will resolve with bronchodilator administration. Option B. Initiate volume-controlled ventilation with a low tidal volume and a slow respiratory rate, aiming for permissive hypercapnia and monitoring for auto-PEEP. Option C. Immediately switch to pressure-controlled ventilation with a high respiratory rate to maximize minute ventilation and improve oxygenation. Option D. Utilize high-frequency oscillatory ventilation as the primary mode, as it is generally considered superior for managing severe bronchospasm. The correct answer is B. Initiate volume-controlled ventilation with a low tidal volume and a slow respiratory rate, aiming for permissive hypercapnia and monitoring for auto-PEEP. Explanation. This scenario presents a professionally challenging situation for a certified flight registered nurse, CFRN, due to the critical nature of mechanical ventilation in a pre-hospital, potentially unstable environment. The CFRN must balance immediate patient needs with the complexities of ventilator management, considering the limitations of transport and the potential for rapid patient deterioration. Careful judgment is required to select the most appropriate ventilation strategy that ensures adequate gas exchange while minimizing risks such as barotrauma or volatrauma. The correct approach represents best professional practice by prioritizing patient safety and evidence-based care within the regulatory framework governing CFRN. This involves a thorough assessment of the patient's respiratory status, including lung compliance, airway pressures, and oxygenation/ventilation parameters to guide ventilator settings. Adherence to established protocols and guidelines for mechanical ventilation in critical care transport, as mandated by relevant aviation and nursing regulations, is paramount. This ensures that interventions are not only clinically sound, but also legally defensible and ethically aligned with the CFRN scope of practice. Incorrect approaches fail to meet professional standards due to several regulatory and ethical failures. One incorrect approach might involve blindly applying standard ventilator settings without considering individual patient physiology or the specific transport environment. This disregards the CFRN responsibility to individualize care and could lead to adverse events, violating the ethical principle of beneficence and potentially breaching regulatory requirements for competent practice. Another incorrect approach could be to rely solely on visual cues without objective monitoring of ventilator parameters, which is a failure to utilize available technology and data to ensure patient safety, contravening guidelines for diligent patient care. A third incorrect approach might be to neglect to reassess the patient's response to ventilation after making adjustments, which is a failure to provide ongoing, vigilant care and could result in prolonged periods of inadequate ventilation or lung injury, a direct violation of the duty of care. Professionals should employ a systematic decision-making process that begins with a comprehensive patient assessment, followed by a review of available clinical data and patient history. This should then be integrated with knowledge of mechanical ventilation principles and current best practices, considering the specific constraints of the transport environment. The CFRN must then select and implement the most appropriate ventilation strategy, continuously monitor the patient's response, and be prepared to make timely adjustments based on objective data and clinical changes. This iterative process, guided by regulatory mandates and ethical obligations, ensures optimal patient outcomes. Question 19. Quality control measures reveal a recent aeromedical transport where a patient experiencing significant pain and anxiety during a critical care transfer was administered a sedative and analgesic. Following the initial administration, the flight nurse noted a decrease in the patient's reported pain and anxiety. However, the nurse did not perform subsequent reassessments of the patient's respiratory status or level of sedation for the remainder of the flight, relying solely on the initial positive response. Which of the following approaches best reflects the appropriate management of sedation and analgesia in this scenario, adhering to regulatory frameworks and best practices for certified flight-registered nurses? Option A. Administer the initial dose of sedation and analgesia as per protocol, but only reassess the patient if they exhibit overt signs of distress or deterioration. Option B. Administer the initial dose of sedation and analgesia as per protocol, then continue to monitor the patient's vital signs and level of consciousness at regular, predetermined intervals throughout the flight, adjusting the medication as needed based on reassessment and communication with medical control. Option C. Administer a higher initial dose of sedation and analgesia than recommended by the protocol to ensure the patient remains comfortable for the entire flight duration. Option D. Administer the initial dose of sedation and analgesia as per protocol, and if the patient appears stable and reports reduced pain, continue the flight without further detailed reassessment until arrival at the receiving facility. The correct answer is B. Administer the initial dose of sedation and analgesia as per protocol, then continue to monitor the patient's vital signs and level of consciousness at regular, predetermined intervals throughout the flight, adjusting the medication as needed based on reassessment and communication with medical control. Explanation. Scenario analysis. This scenario presents a common challenge in critical care transport, balancing the need for effective patient management, sedation, and analgesia with the inherent risks and the dynamic environment of aeromedical transport. The challenge lies in ensuring that protocols are not only followed, but are also adapted appropriately to individual patient needs and the evolving clinical picture, all while adhering to strict regulatory guidelines for patient safety and care quality. The flight nurse must exercise sound clinical judgment, integrating protocol knowledge with real-time assessment and intervention. Correct approach analysis. The correct approach emphasizes a systematic, evidence-based, and patient-centered strategy. It involves a thorough pre-transport assessment to establish a baseline, followed by the administration of sedation and analgesia according to established protocols, with continuous reassessment of the patient's response. This approach aligns with best professional practice by prioritizing patient safety through vigilant monitoring, timely adjustments based on clinical indicators, and clear communication among the transport team. Regulatory frameworks for flight nursing typically mandate adherence to approved protocols, continuous patient monitoring, and the ability to escalate care or modify interventions based on patient condition, all of which are encompassed in this approach. Ethical considerations of beneficence and non-maleficence are upheld by ensuring effective pain and anxiety management while minimizing adverse effects. Incorrect approaches analysis. One incorrect approach involves administering sedation and analgesia based solely on the patient's initial presentation without ongoing reassessment. This fails to account for potential changes in the patient's condition, the development of tolerance, or the emergence of adverse effects. Regulatory failure lies in the lack of continuous patient monitoring and adaptive management, which are fundamental to safe patient care in a transport setting. Ethically, this approach risks patient harm by not responding to evolving needs or complications. Another incorrect approach is to deviate from established protocols without a clear, documented clinical rationale and without consulting with medical control. While protocols provide a framework, clinical judgment is essential. However, arbitrary deviations can lead to suboptimal care or adverse events. Regulatory failure occurs when care deviates from approved standards without proper justification or oversight. Ethically, this can be seen as practicing outside the scope of established guidelines and potentially jeopardizing patient safety. A third incorrect approach is to prioritize speed of administration over thorough patient assessment and monitoring. In the urgency of transport, there can be a temptation to administer medications quickly. However, this can lead to overlooking critical contraindications, underestimating the patient's tolerance, or failing to recognize early signs of respiratory depression or other complications. Regulatory failure stems from a disregard for essential safety checks and monitoring requirements. Ethically, this approach prioritizes expediency over patient well-being and safety. Professional reasoning. Flight nurses must employ a decision-making process that begins with a comprehensive understanding of approved sedation and analgesia protocols. This understanding must be coupled with a robust assessment of the patient's current status, including vital signs, level of consciousness, pain score, and any contributing factors. The decision to administer medication should be based on the assessment and the protocol's guidelines. Crucially, this decision must be followed by continuous, vigilant monitoring of the patient's response, including vital signs, level of consciousness, and any signs of adverse effects. The flight nurse must be prepared to adjust dosages, administer reversal agents, or escalate care as indicated by the patient's condition and in consultation with medical control. Documentation of all assessments, interventions, and patient responses is paramount. This systematic approach ensures that patient care is safe, effective, and compliant with regulatory standards. Question 20. System analysis indicates a certified flight registered nurse, CFRN, is transporting a patient with severe, uncontrolled hemorrhage from a traumatic lower extremity amputation. The patient is hemodynamically unstable, and the flight is experiencing moderate turbulence, making precise ground-based wound packing techniques difficult. The CFRN has access to standard flight nursing equipment, including tourniquets and hemostatic agents, and has received training in their application. The patient's condition is rapidly deteriorating. What is the most appropriate immediate management strategy for the extremity trauma? Option A. Apply a commercially available tourniquet proximal to the amputation site to control the hemorrhage, while simultaneously preparing for advanced airway management if the patient's hemodynamic status continues to decline. Option B. Delay definitive hemorrhage control until the aircraft lands and the patient can be transferred to a facility with more advanced surgical capabilities, focusing solely on basic airway and ventilation support during the flight. Option C. Administer a large bolus of intravenous fluids and pain medication to stabilize the patient, and monitor vital signs closely without attempting direct intervention on the bleeding extremity due to the turbulence. Option D. Attempt to pack the wound with gauze and apply direct pressure, as this is the standard protocol for hemorrhage control in all trauma patients, regardless of the transport environment. The correct answer is A. Apply a commercially available tourniquet proximal to the amputation site to control the hemorrhage, while simultaneously preparing for advanced airway management if the patient's hemodynamic status continues to decline. Explanation. This scenario presents a significant ethical and professional challenge for a certified flight registered nurse, CFRN, operating under U.S. federal regulations and aviation law, specifically concerning patient care during transport. The core dilemma lies in balancing the immediate, life-saving needs of a patient with severe extremity trauma against the established safety protocols and the limitations of the flight environment. The CFRN must make a rapid, critical decision with potentially life-altering consequences for the patient, while adhering to their scope of practice and the overarching responsibility for flight safety. The correct approach prioritizes immediate, life-sustaining interventions for the patient's critical extremity trauma, even if it requires a deviation from standard ground-based protocols, provided it is within the CFRN scope of practice and does not compromise flight safety. This aligns with the ethical principle of beneficence, the duty to act in the patient's best interest, and the CFRN professional obligation to provide advanced nursing care in the pre-hospital and interfacility transport setting. U.S. Nursing Practice Acts and professional standards for CFRN emphasize the need for critical thinking and adaptation of care in dynamic environments. The decision to administer a tourniquet, if indicated by the patient's condition and within the CFRN training and protocols, is a recognized intervention for severe, life-threatening extremity hemorrhage. This decision is supported by established emergency medical protocols and the CFRN role in stabilizing patients during transport. An incorrect approach would be to strictly adhere to ground-based protocols that may not be feasible or appropriate in a flight environment, thereby delaying or withholding potentially life-saving treatment. This could be considered a failure of professional judgment and potentially a violation of the duty of care. For instance, refusing to apply a tourniquet for uncontrolled hemorrhage due to a perceived lack of direct physician supervision, when protocols allow for such interventions by trained CFRN in emergent situations, would be a significant ethical and professional failing. Another incorrect approach would be to prioritize the comfort or convenience of the flight crew over the patient's immediate medical needs, such as delaying necessary interventions due to concerns about potential mess or disruption. This would violate the principle of patient advocacy and the primary responsibility of the CFRN to the patient's well-being. Furthermore, attempting interventions beyond the CFRN scope of practice or established protocols without appropriate consultation or authorization would constitute a regulatory and ethical breach, potentially jeopardizing both the patient and the flight. Professional decision-making in such situations requires a robust framework that includes rapid assessment of the patient's condition, understanding of the immediate threats to life, knowledge of available interventions within the CFRN scope of practice and the flight environment's limitations, and consultation with medical control when necessary and feasible. The CFRN must weigh the risks and benefits of each potential action, always prioritizing patient safety and the provision of advanced life support. This involves a continuous cycle of assessment, intervention, and reassessment, adapting care as the patient's condition and the transport environment evolve.